Hello everybody, this is Karm and I am the lead assistant here at Agape Dental. I am sitting with Dr. Daya today, who has just won as the best cosmetic dentist in all over Edmonton on ThreeBestRated website. We will be asking her questions and trying to understand how she has been able to provide the services she has been providing and maintaining her status as best rated cosmetic dentist in Edmonton since last 4 consecutive years. So let's dive in. Let's see what we get. All right, Dr. Daya, thank you for agreeing to have me interview you. I have some questions that I am going to ask, just trying to figure out how you as a service provider maintain the level of service you are providing. First question I have is, you were raised in Edmonton, and technically Millwoods is your community where you grew up. How does it feel to own a clinic in the same community where you grew up and provide the services to the people of the community?
So yes, it's very exciting to own in Millwoods. As you mentioned, I had my early formative childhood years in Millwoods, and owning Agape here in this community, it feels like I've come full circle. There's a level of trust and responsibility that comes with that care, because oftentimes I see patients who are friends of family or people that I've known for a really long time, and it affects how I interact with them and the relationship that I have with them and the level of service of care that I can provide because I know them on a personal basis.
Now, you have been providing cosmetic services for a while now.
Yeah.
How do you think has the demand evolved over the years after the more awareness in general public, and anything that has changed over the years in terms of requests from the patients?
So it's definitely evolving. The way it evolves is really interesting in the sense that probably after COVID, when people were on Zoom, the social media awareness of people's smiles, their social media knowledge increased drastically. People were seeing themselves on screen a lot more and seeing their smiles, and it affected their confidence levels for a lot of people. So I find that increased the demand, but like I said, it also increased their knowledge base. So people aren't just looking for a quick fix. They're looking for something that will last a long time, that's minimally invasive, and their dental IQ has drastically increased because people are doing the research behind their treatment before coming in for cosmetics.
Now, you have been doing so many services even under the umbrella of cosmetics. What is the most requested service that usually your patients ask for?
So here in Millwoods, I think that the top 2 services that we are requested for consultations initially are usually clear aligner therapy and veneers. You know that. You assist me on the consultations. So those, I think, are the top 2 services. And even though they come in requesting veneers, sometimes as a clinician, it's my responsibility to guide them in what's actually right for them. And you know that, because we have to lay the foundation sometimes to put teeth in the right position and start with clear aligners, even if they never considered that before, and then do the veneers as an ending point. So it doesn't necessarily mean that they're going to get just clear aligners or almost never just veneers. Sometimes we'll incorporate whitening with it, but those 2 major services are what they initially come in for.
Perfect. Now, providing treatments like this, say clear aligners, whitening, veneers, or a full comprehensive treatment, how do you feel that affects the confidence and morale of a patient after the treatment is completed?
Oh, it's absolutely life-changing. That smile transformation is one of the big reasons that I got into cosmetic dentistry, because yes, early on in my career, I was providing more of the bread and butter general dentistry, drill and fill style. But when I got into treatments like veneers and that smile transformation, That's when you see the impact that you have on a patient's confidence. You see how they interact socially. You see how they like carry themselves, their walking attitude, just everything about them transforms.
Now, Agape Dental has a reputation to be up to date in terms of technology in the community. Can you tell us a little more of how you investing in such heavy technology-driven clinic affects or benefits the patient?
So specifically with respect to the cosmetic dentistry part, I think the fact that we have both the Prime Scan and the iTero, and we use that to have the precise 3D imaging for that patient to be able to see what their teeth initially look like at the consultation visit, and then uploading that into a digital smile design platform to be able to show a patient their smile mock-up, that's huge because patients want clarity. They don't want to invest in something without knowing what the outcome's going to be. You know that. They're making financial decisions, they're making, time commitments. They want to know what they're getting into, and being able to showcase that to them and being able to have that informed consent is huge.
Now, we have been aware about tons of different technologies coming out for cosmetics per se. How do you think the technology will keep evolving, say, even in 2026 and beyond 2026, in terms of digital integration, like you talked about, in terms of new technology?
I think the future is going to be very much about the seamless workflow, like you mentioned. It's going to be about that integration from scanning to actual treatment planning to delivering the final result. It all has to, like you say, flow. And that is where the future is going to be. You want precision, you want efficiency, you want clarity. All of those are going to become even more important. But I think that where the future is going, and I think last year and this year, there's been a big integration on AI. You know that. And we're looking into how to integrate that here at Agape. But what I always like to tell patients, and if they're watching this, I want them to know that for us, AI is an added tool on the treatment planning. It doesn't take away from clinical judgment. You still need a dentist to actually drive that treatment plan.
Now, when we mention it still needs clinicians' judgment, you have done so many cases over the past years.
Yeah.
Can you tell me a particular case that was the biggest transformation that you have done and how that has changed your perspective on cosmetic dentistry and how that changed the patient's life per se?
So there's not just one case that stands out for me. There's I'd say my top two cases that stand out for me. One of them is, as you know, a guy with a left arm amputation, and he wasn't able to do traditional braces, and he came to us for clear aligners. And he had super crowded teeth, cross bites, and we treated him with Sure Smile, and we got an amazing transformation. But what I loved about it is that as he progressed through that treatment, you could see his increase in positivity, his increase in confidence. And the fact that he was so motivated by seeing that progression was huge. And then his final confidence is just life-changing.
Out of the park.
Yeah. But I think that's my big why. And even I mention it when I speak for Sure Smile, that his case is my big humbling, grounding moment in terms of cosmetic dentistry. But his was not involving veneers or in that sense of comprehensive full mouth reconstruction or anything like that. It was simply clear aligners with whitening that got such a big change. My other case is also really simple. A patient that had 2 peg laterals, you probably know who I'm referring to, and we didn't do fancy smancy stuff. We did whitening, 2 simple veneers for peg laterals, and his smile is so wide now, and he smiles confidently and radiantly. And that's what drives me in the cosmetics, is that sometimes you have to pick out just those couple of things that are a patient's chief complaint. And what impacts their confidence? What are they really concerned about? And actually listen to the patient on that, because sometimes it doesn't mean 10 veneers.
Right.
Sometimes it's like little small changes can make a huge difference.
Yeah.
Yeah.
Now let's talk about the practice.
Yeah.
There are a lot of other practices in the area that also provides cosmetic services.
Almost everybody does.
How do you think Agape is different than the rest of the practices?
I think for us, it's about patient education on comprehensive integration of treatments. We're, like you said, we're not here to just do a big fix, aggressive treatment. We do it staging. We work with the patient's insurances. We work with their timelines. We offer the flexible payment plans with 0%. That's huge in Millwoods because we want cosmetics and that confidence to be accessible to everybody in the community. And that makes us different. And we'll, like I said, sit with the patient in a consultation and really listen to them and hopefully engage with them and build that long-term relationship to get that final result.
Now, being a very reputed clinic in the community, what are your goals in terms of growth, even till the end of the year or coming years later down the road?
So you already know this. We're already planning, hopefully, a renovation for next spring. That's right now my biggest goal. Because I want patients to have a modern experience, a comfortable experience. But for the team, I also want efficiency. And I'm hoping that that renovation will help create a better patient experience all around, from the patient and the team. But also for me, I also, invest heavily in continuing education. So when a patient goes through like clear aligner treatment and has a missing tooth that they need to replace, I get that we currently offer the posterior implants, but my next goal would possibly be to incorporate anterior aesthetic zone implants so that we keep more stuff in-house. Now, that's not to say that I don't love multidisciplinary treatments and I absolutely love my specialists that we work with, but patients often don't want to go elsewhere. So the more that we're able to offer in-house, that's my growth. But also, growth isn't just about offering more services. It's about leveling up your standard of care from internally progressing to be like, how am I going to do better than I did yesterday? And so that I started taking a lot more camera pictures of our treatments to be able to analyze where you can improve, and what the camera sees is not always what you see chairside. So that's also really big for me, is self-criticism and self-analysis for growth. Not to be hard on yourself, not to aim for perfection, but just to aim for improvement.
Perfect. Now, we're almost at the end. The last question that I have is, how has the three best rated helped in terms of our visibility, our reach to provide services to more patients compared to before, when you were not officially recognized as a position that you are now?
So, like I said, that since COVID, patients do a lot more research. And when they're investing in something, they want someone with a reputation. So the fact that there's credibility behind us gets us a lot more consultations. And it gives us, like I said earlier in the interview, a little bit of authenticity, right? So they've done their research and then they're coming to us already knowing that this is our portfolio, this is who we are, this is our ranking. It's a little bit of trust. And hopefully we live up to their expectations and provide the services that they look for. But if we can't take on a case, we also tell them honestly, like, this is a specialist case, or, I'm not the right fit for you. I can't do what you're asking me to do. We just have to be honest about it. And that integrity also helps our ranking. You heard a little bit about me and about Agape Dental from Karm's interview questions. So if you would like to become a patient, or if you're an existing patient at Agape and are interested in any of our cosmetic services or any other treatment, and if you're looking for a dentist as a general dentist, for anything, feel free to contact us. Remember that for cosmetics, we do offer free consultations, and we want this treatment to be accessible to the public, so we offer 0% financing, and we would love to see you soon. Give us a call.